Let me introduce myself a moment. I'm Wim Schellekens. I'm the Chief Inspector of the Dutch Healthcare Inspectorate, and I'm involved in quality improvement quite a long time. You know, my personal motivation to do quality improvement work and to work on safety is that healthcare is meant to relieve suffering, to help patients, to cure them, to care for them. But in a way, bad quality and unsafe care adds suffering to the patient. You know, wound infections, bed sores, medication errors, waiting, no information adds suffering, unnecessary suffering to the patient. And that's not what healthcare is all about. Healthcare is to relieve suffering. And it is my personal motivation to relieve that suffering because we have to help our patients to relieve their suffering. So bad quality and unsafe healthcare, let's get rid of it. Yesterday, Maureen told us about personal stories you can read on the New York Times website. There are 220 patient stories about 30 illnesses. And nothing is more strong to convict yourself that we are in a really serious business is to read patient stories. So I advise you to go to the New York Times. But it's also important to listen to the stories of the doctors. There is a booklet in the Netherlands that showed 11 stories of famous doctors in the Netherlands, really known doctors in the Netherlands. And they told their own story of a very serious patient incident or a calamity. And this booklet was translated into English just special for this conference. And you can have it free. It's at the entrance, so take an opportunity to read about 11 doctors who are very open about what their personal story was about a very serious patient incident. And now I'm very proud to introduce our plenary presenter this morning. I'm very honored to introduce him because he is in the Netherlands a very famous, very well-known person. He was the former president and CEO of Shell Netherlands. And you know, Shell is a company with a yearly budget that's bigger than our gross national income. So in a way, he led a company that is bigger than the Netherlands. He now is Member of Parliament in the House of Lords for the Christian Democratic Party. He is very special to us because Rein Willems, within Shell, gave top priority to safety. He made safety a central issue in his business strategy. And that was the reason that in 2004, the Minister of Healthcare asked him his advice, how can we improve patient safety in healthcare? What can we learn from Shell that we have to adopt and have to implement in healthcare? And in that time I visited him in his office in The Hague. And when I arrived by car, that building was in reconstruction. And there was a big sign on that reconstruction area and that said, "This is a safe workplace." I never entered a hospital that said, "This is a safe hospital." Second thing I noticed when I came into the building, that it is a rule within Shell that you never walk the stairs without one hand on the railing. So you are not allowed to walk the stairs without a hand on the railing. So you can't go with your papers in both hands walking down the stairs. That's too dangerous. And it's a very small thing, of course, but it's a sign, a symbol of what safety can mean in a company. But he can tell about it himself in a much more eloquent way. So his report to the minister made it possible in the Netherlands to set the floor for a national patient safety campaign. And we still are very busy in the Netherlands because of the report of Mr. Rein Willems. The floor is yours.